Welcome to Legal 123s with ByrdAdatto. Legal issues simplified through real client stories and real-world experiences. Creating simplicity in 3, 2, 1.
Welcome back to another episode of Legal 123s with ByrdAdatto. I'm your host, ByrdAdatto, with my co-host, Michael Byrd.
Thanks, Brad. As a business and healthcare law firm, we represent clients in multiple sectors and multiple specialties, including healthcare.
Yep.
This season, our theme is Specialty Spotlight, where each episode will visit about some of the nuances that can be found from a business and healthcare perspective in the various practice specialties.
Michael, today we actually have a guest in studio, and I think we've known him as long as you have known me.
We go way back with our guest today. In fact, we started working with our guest when he was an employed physician on the early side of his career.
Yeah, and I can tell by your body language that you want me to talk about something. So let's go ahead, get it out of the way, not be distracted, because we do have a guest in studio. So what are you going to throw at me today?
Have you played pickleball yet?
No, but I have played wiffle ball and ping pong. Does that count?
Well, kind of.
Okay.
But I'm a little snarky about it. Now,
Okay.
I've not played yet. As you know, I'm a tennis player, and I'm a little embarrassed by this, but I have had kind of that tennis purist attitude towards pickleball historically.
This does not surprise me at all, Michael. You do like to look down on people, audience members, especially those who don't go to state for typing. So if you've never gone to state for typing, Michael is judging you.
I think you're overplaying the typing thing, Brad.
Okay, sorry.
Okay, but I am, as far as pickleball, I have to admit I'm starting to soften about it. I'm getting curious. And I also that this is not a healthy attitude to look down on something like this. And I can kind of see what's happening. It's kind of like when snowboarding started invading the snow skiing world, and all the traditional skiers, which was me, complained about how the snowboarders were messing up the mountains.
Yes, you are sounding like an old man, get off my porch moment. But yeah, pickleball, I've definitely seen this wave of momentum definitely sweeping across the country.
I know. I read several articles about it, which has kind of stoked my curiosity. And I mean, there are titles like, Pickleball Can Save America, and how it's playing a part in bringing people together with different views. And I think the draw, at least according to the articles, is that it's an easy to learn game, and that people of different skill sets can play together. But I recently read about the emerging dark side to pickleball.
Yes, first off, I did read that same article about Pickleball Saving America that did pique my interest. It was a very fascinating article. But learning also that there's some conflict out there is actually even more fascinating.
I know. Well, like most good things, money will start to mess things up.
Yes.
And so this organic, almost hippie type sport is starting to make a lot of money out there. And there is an intense battle among a few players to be recognized as the Pickleball Association.
Yeah, I know it's in its early stage with pickleball, but when I started reading about this, learning more about the fight, it actually started reminding me what's happening right now in golf with the PGA and LIV, and now this is actually playing out in the pickleball world.
Yeah, pickleball is a little lower profile, but yes, you're right. So apparently the fight is among the Association of Pickleball Professionals, Major League Pickleball, and the Professional Pickleball Association.
Yeah, I knew there was an association out there. I had no idea there were multiple associations out there.
So no one's going to remember what I just said, including me, so we'll just go by initials. The
Okay.
APP
Sure.
and the MLP are two of the first associations, and they were formed organically as part of this love for the sport, and they seem to coexist well together. The PPA, on the other hand, is newer. It was recently developed by Texas billionaire Tom Dundon, who also owns the Carolina Hurricanes hockey team.
So is he like the MVP of the PPA?
I have no idea what you just said, but big money's entering the picture. He was strategic, so he's acquired a couple of companies. He acquired one company that has 2 decades worth of player and event data for pickleball, which who knew it even actually went back that far, but it does. It goes back to the 70s. And acquired the website that's the only website out there that organizes all pickleball tournaments.
So one thing we can learn is your name would not be on any of those websites.
This is true.
Yeah.
I still have not tried it.
Okay.
The latest move, which kind of goes back to your live tour thing,
Yeah.
is the PPA is now signing the top pros in pickleball to contracts where they sign over all of their name and likeness rights and agree to exclusively be part of the PPA. Now, mind you, this is a young sport, so they're not even the best of the best are in the scheme of things, especially when you think about sports, not making a ton of money. So these contracts, these guaranteed contracts are pretty lucrative, but they're also extremely restrictive.
So how's this going to play out, Michael?
It's the early stages. It does randomly look like Austin, Texas is kind of the pickleball epicenter.
Okay.
And where this fight will play out. The players who signed these contracts with the PPA are starting to realize that they signed their life away. They particularly don't like the fact that they cannot participate in the events of the other associations.
Oh, yeah. That is the golf.
And the only thing we know for sure is that the unifying love vibe for pickleball is, at least at the pro level, starting to dissipate.
So let's get back to my question I started with. We have a guest in the studio. How does this connect to him? Is he like the pickleball pro that I didn't know about?
It's a loose. I really read the story and wanted to talk to you about it. And we've been through a few intense business negotiations with our guest today over the years. We've worked together for a really long time. And I remember it was all green pastures and fun at the very beginning when we were talking about what it would look like to become a partner in a practice. And then we all got to grow up together real fast through a couple of business deals. So it reminds me of kind of the dream versus reality of getting through things.
All right. Well, he's sitting right here. He's been very patient with you, Michael, on your pickleball fascination. Please bring on today's guest.
Let's call it curiosity as opposed to fascination. Our guest today is a longtime friend and client, Dr. Richard Hostin. Rick is a spine surgeon, fellowship trained in orthopedic surgery. Rick treats the most complex cases, including scoliosis, complex spinal deformity, and advanced spine surgery. He is a UC Berkeley undergrad, OU Medical School, UC Davis residency, did his fellowship at Twin Cities Spine Center in Minneapolis, and is currently the medical director for Medical City Scoliosis and Advanced Spine Center here in Dallas. Rick, welcome.
Welcome. It's interesting, the pickleball story. If you guys knew how much I heard about pickleball amongst the retiree crowd in Texas, you'd fall out of your seats. And that actually explains a little bit because I didn't realize there was that much big Texas money behind it. So that's interesting. I think both the pickleball bickering and some of the stuff we see in the practice landscapes is what I like to call people being people. So these types of things, it's always plays out every, 20 years and every different thing always. And some of I think the struggles that the PGA and the Pickleball Association go through are the same kind of reasons that, some of the guys doing practice contracts and bringing on new guys, kind of the same kind of mindset, which is, old school way of thinking, and there's a young upstart and things don't work that way anymore. And you get into all this stuff, and it's just the natural order of things. And, I think the benefit of working with good attorneys who do this stuff all the time is that it's hard to see something you guys haven't seen before. And a lot of this stuff, I think you have to have a little bit of a sense of humor when you're going through these processes with things, because it's just part of it's contract and paper and law, and part of it's personal psychology and people. And ultimately, it's nice to have guys who've worked with a lot of people and seen a lot of different personality types to try to get deals done, which is ultimately what all of us want.
Absolutely. So I guess based on your response to pickleball, and you referred to the retirees, you are not one of the retirees, so you're not playing pickleball right now?
Hopefully now that the bird's getting interested, it tells me he sees the light at the end of the tunnel and maybe heading for the pasture. When you get your retirement baton, you're going to pick up that pickleball racket, put down the tennis racket. I guarantee you.
It's my plan B for when Brad runs me out of here.
There you go.
Yeah, I think it's popular amongst the retirees because you can enjoy racket sports and it's not as much running and it's not as hard on the body. So people can play more regularly and not beat themselves up. And it's hard to run around when you're in your 60s or 70s like you do in your 30s.
Yeah, no doubt.
Well, cool. We're glad you're here, and we are not here to talk about pickleball.
No.
I love the people being people connection.
Yes.
This is so true in anything. Well, let's start and just give the audience a little context and just introduce kind of the audience to your specialty, which, broadly is spine surgery, but you are in a kind of a very specific area of spine.
So, spine's a fairly broad field, and guys doing spine surgery can be either orthopedic trained or neurosurgery trained. And many, many, many years ago, the specialties were a little bit discrete. So most of the guys who did a lot of instrumentation or putting screws and rods, Harrington rods, these sorts of things. And Harrington was a Texan, obviously, from Houston. So Texas has a rich history with spinal deformity surgery, tended to be orthopedic guys. And the neurosurgeons tended to work more on spinal cords and nerves, do decompression work, spinal cord tumors, dethetherings for spina bifida, these types of things. But, over the last 25 years, the specialties have really come together. So there's a one spine movement where a lot of the fellowships now take, part of the guys as neuro and part of the guys as ortho. And the training is sort of much more homogenous. Now, I would still say amongst maybe the spinal deformity and scoliosis crowd, there's still a bit of an orthopedic bias because of the historic training programs and the older guys that went through training years ago. But we're seeing the specialties become much more sort of uniform, and just vice versa. A lot of the orthopedic guys are now very facile at complex tumors and intradural work and things. So we still do cases with each other. And again, a lot of it has to do with your individual experience and what you like to do lots of. So there's guys whose whole practice is doing nothing but spinal tumors. There's guys whose entire practice is nothing but very complex reconstructive spine scoliosis surgery. There's guys that do nothing but Chiari malformations. So like anything, whether it's law or medicine or being an auto mechanic, if you do a lot of one thing a lot, you tend to become very good at it and very safe at it and very do it well. It's a little bit hard in spine to be really great at every super complex thing there is. So those of us have been in the game a long time, know where our real skill sets are, where we shine, and then load the boat. If we've got new technologies that we think would fit a patient well that maybe we're not, the best at, we're quick to, bring either other guys on board or send those cases to them so that, patients get the best outcome, which is really what everybody who is a good doctor wants, which is you fix people's problems, you minimize your complications, and you do it in the most cost-effective way possible.
Sounds like the Pickleball Association should bring him in, because if you're bringing orthos and neurosurgeons together and you're doing it for the best outcome, that's what the Pickleball Association, bring it back to them. They need Rick to come in and help do that. Bring the right people onto the boat, as you said. That's fascinating to hear that, because I know, growing up with my dad being an orthopedic surgeon, there was a big distinguishing aspect for a long time between their different specialties, and to hear how you're coming together for the patient health, that's a fascinating move, which I think, as you said, it's relatively newish to the industry, especially with the fellowship aspect to it.
And there's still, institutionally, there's still places where there's a lot of tension in, academic departments between, who does what and who gets what referrals and who, and that's, politics on a local level. I would say nationally amongst the field and thought leaders, there's less of that divisiveness, and I think more press for uniformity and standardization of treatment care. I think a lot of us want to see better data and better evidence and less variability in treating patients with various conditions, not just complex scoliosis, but general spine conditions. So there's been a big push to have larger national, type data sets where we really look at, what are the best treatment options, what's the literature say, what are areas that require study, and to have pooling of data both in the European populations and as well as here in the U.S. I would say, as opposed to orthopedic joint replacement, we are not yet as uniform in terms of recommendation of treatment strategies for various conditions. And that can cause confusion for patients because Dr. A says, I would do it this way, and Dr. B says, I would do it that way. And the reality is, and a lot of times the literature is equivalent on that. So there's more than one way to roam,
Sure.
and the recommendation of the technique that's best to fix the problem is often the technique that the guy is best at.
Yeah.
And a lot of times, there's more than one way to do a surgery. The key is to do them safely and to have good results. And, if you work in a big metroplex like Dallas, where things are competitive, or New York, there's a lot of very good people. So generally speaking, if you're a guy that's not a good surgeon, who doesn't do well with patients and doesn't have good results, you're not going to survive long, ultimately. And we in Dallas have had a few outliers. We had the Dr. Death guy here, years ago, and there's podcasts about that. But that is really an exception. And that guy basically got burned at the stake. You saw that guy got life in prison. It has never happened before because it was just that type of thing is so. All of us who do anything in healthcare for orthopedics never see anything like that.
Yeah.
Just completely an outlier. Most of the folks you see are looked at pretty carefully. There's big departments with neuro and ortho guys, and there's a lot of homogeneity for surgery results.
So for our audience members, I know the difference, but I think for them to understand, when you're doing a scoliosis surgery, what is the time commitment and staffing need for that versus I use the term loosely, a simple spine surgery versus, because I know like some things are in a spine surgery can be very not non-invasive, but can be very microscopic, while scoliosis surgery is a completely different animal by itself.
So spine surgery is kind of going through some of the transformations we saw with joint arthroplasty a number of years ago. So if you look at the joint arthroplasty stay, joint arthroplasty largely has moved to an outpatient procedure. And it used to be, 4 days in the hospital and a rehab stay. Spine surgery in the general setting is moving more and more outpatient. So minimally invasive techniques, a lot of things allow the procedure to be done in surgery centers with day surgeries. We as a deformity surgeons with big reconstructive procedures, we are not in that boat.
Right.
Just like doing, tumor arthroplasties or more complex joints, that stuff is still in a big facility. So we're, in our practice, really anchored to inpatient facilities where we have good critical care, good vascular, good cardiac coverage, because they're large surgeries, and we look for institutions that have strong benches in terms of critical care needs and all the things we could do in case something happens or we need support. What you don't want to be doing is a big surgery in a little place without a good blood bank, without good ICU, without good critical care, because that's when you get into trouble. So there's starting to be a bigger and bigger kind of separation between what I would call general spine or routine spine and some of the more complex reconstructive work, where a lot of times we're not even in the same facilities anymore like we used to be, because I think so many of the advances, some of the endoscopic decompression techniques, minimally invasive techniques, better perioperative pain management are allowing these things to be done outpatient. But scoliosis is not going to be on that list anytime soon.
Yeah. Well, let's pivot a little bit, because I'd love to, you have had a lot of experiences on the business side of medicine, and would love just your perspective on kind of some of the biggest business challenges that you see kind of in a spine surgery practice.
I think all of us in healthcare as physicians have kind of seen a bit of an erosion of autonomy and what I would call the corporatization of medicine. And I think some of the older school physicians who are, I'd say 55 and up, it's been a big challenge just to get their head around that fact. COVID in some ways has really accelerated a lot of the pressures on the practices. So the challenge has been you have a declining reimbursement environment, you have an increasingly restrictive regulatory environment, and you have dramatically increasing overhead. So the COVID thing has pushed the healthcare employees just out of the market. So, everybody is fighting to the death over every last employee to try to retain them, because there are just not enough people.
Yeah.
I mean, and not even kind of enough people, not even remotely close to enough people to just staff the hospitals, much less ASCs, doctors' offices, imaging centers. So it's really been a challenge to, number one, provide work environments where you can, number one, recruit, and number two, retain good people, because you're only as strong as your weakest link in dealing with the patients. And then number two, to do so in a way that you don't like start taking out loans to show up to the working. So that's been a little bit of, I would say, a challenge for everybody. Spine surgery, if you look at most hospitals, there's only 4 or 5 service lines that are particularly lucrative for the healthcare facilities. And spine surgery and orthopedics is one of them, neuro, oncology, I would say, sometimes bariatrics and other things. But there's not like an unlimited bench of every subspecialty that the hospitals have a tremendous interest in. So spine surgery practices, I would say, in big metroplexes, there's been a lot of recruitment. Everybody always wants you to bring in new guys because they see, hey, this is potential revenue growth for the hospital and we have a need. But, you have to keep an eye on, does the marketplace really need that? How many new guys can you absorb? And what you don't want to do is create pressures where, people are being more aggressive with indications than they should be because they're slow. And then that's, really as a physician, that is what you have to guard against. And we've always been very conservative on hiring guys, to the point waiting till we're kind of bursting at the seams. So we're confident, look, we're not going to have a guy sitting on his hands and, struggling for work. The COVID situation provided a tough time when we were kind of shut down at the hospitals. We couldn't operate. So a lot of guys were frustrated because they had all overhead they had to cover. They had employees they had to pay, and we couldn't see patients. We couldn't operate. You can't do surgery over telemedicine. So I think it's been a rough couple of years. I mean, I think most of the practices are now coming through it and getting back to the new normal. But it really, I think, accelerated changes in the healthcare landscape very, very quickly. You saw a lot of practices roll into affiliated consolidations with either, if outside of Texas, with insurances, or in Texas where you can't be direct employed, either going back to university type jobs or taking jobs where you're supported by healthcare systems to some degree, either through proxy employees like Health Texas or Physician Services Group, or all these different institutions that the healthcare entities offer, or through contracts with the health systems to help manage some of the practice operational things.
Yeah. And I can fact check you right now on the spot. You're correct that you cannot do surgery via telemedicine. So good catch there.
Brad's really smart.
Yeah.
Not yet. So some of my colleagues with the robots, they dream one day of like operating internationally and
being in Bora Bora and operating from the beach.
Exactly.
Yeah. Well, we've covered a lot in this ground so far, and I guess the last question is, and maybe some of you've already talked about, but from your perspective, what is the biggest healthcare compliance challenge that you face as a spine surgeon?
Well, I think, like many regulatory agencies, people tend to follow the money, right? So the problem is, whether you're a Wall Street trader, and my sister is a BlackRock executive, people look at where the money goes. So if you're in a specialty where either you get paid a lot or your service line is a big revenue draw to the hospital, there's a lot of healthcare dollars that are affiliated with your name. So that's going to bring attention. And you saw, a few years ago, a bunch of guys in town got into trouble with some physician-owned healthcare facilities. And largely, many of these areas in healthcare are sort of shades of gray.
Yep.
And you can have varying legal opinions on what is and what is not okay. Certainly, with the overhead situation, people are always looking for ways to offset practice revenue and expense by bringing in ancillaries or doing things. But we've always been cognizant of the fact that, look, we're doing a lot of things that use healthcare dollars. And you don't want to be in a situation where you're on your heels trying to defend things. So we personally have stayed away from a lot of ownership in implants or what we perceive as conflicts. Not to say those things are necessarily wrong or illegal, and certainly there are ways to do many things, I think, compliantly. But we've been a little on the conservative side because we do need a lot of institutional support to do scoliosis surgery well. So we're asking a lot of the hospital systems in terms of service line resource allocation. And it puts the hospitals in a very bad position if we have conflicts or get into trouble with OIG or somebody like that. And because it can damage the healthcare systems, it can, cause a lot of problems. So we've tended to sort of be, I would say, amongst guys in town, a bit more conservative with those things. And we've maybe, left some revenue on the table that would have been safe to get. But you never know when the winds are going to change. And we like to not be the first guy doing anything, and we probably not going to be the last guy. But we kind of go with, what we are confident established, it's been tested, true, and we know, look, if there's any kind of questions about what we're doing, either from an insurance company, a governmental agency, CMS, that we are very strong, sound footing. And that's where we really count on, you guys to tell us, look, when are we pushing things? What's really safe? Do we feel good about it? And when is it gives me a little bit of concern.
Oh, no doubt.
Yeah. And, obviously kind of a secondary part of that we see with going to your point of, that it's a lucrative field where there's a lot of opportunity is that the doctors, the spine surgeons are going to get presented with a ton of opportunities. Not all of them are going to be necessarily wise opportunities for them to pursue.
Yeah, I tell the young guys, it's a marathon, not a sprint. So the goal of medicine is not to go out there and try to stuff every dollar in your pocket as quick as possible, because ultimately you're probably not going to be doing medicine very well. There's a huge, the difference with running a healthcare business and a lot of just consumer-facing businesses is, the customer is not always correct, right? And you have to, some of the biggest conflicts I've had with patients being dissatisfied is me telling them, I don't think you should have surgery, right? Now, I have to explain to the patients, look, I mainly get paid to do surgery. We get paid very little to talk to people in clinic. And the healthcare systems certainly like us to do surgery because it's profitable for the hospitals. If I am telling you I don't think it's in your best interest to have surgery, it's not that I am insulting you. It's that I'm trying to be your advocate, right. And that's something where it can be a challenge because there are always incentives to overutilize healthcare resources, whether it's personally or institutionally. And that's where specialties in general get a bad rap. So spine surgery, because there's been a large growth in it, there's a lot of looking at what are indications, who's having surgery, is this appropriate? So you don't want to be a guy that's out there pushing the envelope and operating everybody that comes in. And that's also where spine surgery can get a bad rap. If you have very good, tight indications for surgery, I think the results are very on par with hip and knee replacement. If you start operating on stuff that's got marginal indications, then that's when the results are sort of not necessarily as good. So you have to be sort of conservative. And I think in the business and contractual relationships, you have to be mindful of that. So you have to set up things in a way that there's not a huge either direct or indirect incentive for you to be overly aggressive because there's pressures on you. And that's when we've aimed to do contracts with either partners or healthcare people, we've tried to de-emphasize you get paid for every widget you put in or something like that. We want people to emphasize the patients have a good experience, they get better, you're doing appropriate care, we're doing good research, and we're keeping a close eye on, the results we get.
That's amazing. I can't believe we're already blew through our time like we do every time. It was amazing and interesting, just like all of our conversations. So what we'll do next is we'll say goodbye to our guest. Rick, thank you so much for joining us today. We'll go into a commercial, and then we'll come back and do a quick legal wrap-up when we get back from commercial.
Absolutely. Thanks for joining us.
Awesome.
Many business owners use legal counsel as a last resort rather than as a proactive tool that can further their success. Why? For most, it's the fear of unknown legal costs. ByrdAdatto's Access Plus program makes it possible for you to get the ongoing legal assistance you need for one predictable monthly fee. That gives you unlimited phone and email access to the legal team. so you can receive feedback on legal concerns as they arise. Access Plus, a smarter, simpler way to access legal services. Find out more. Visit ByrdAdatto.com today.
Well, welcome back to Legal 123's with ByrdAdatto. I'm your host, ByrdAdatto. My co-host, Michael Byrd, still here. Michael, we're having this season where we're doing the Specialty Spotlight. And for those watching us on our YouTube channel, you'll see the spotlight was three handsome men in blue suits in the blue podcast room of the Legal 123s with ByrdAdatto. So I thought that was pretty well planned since we all were wearing basically the exact same blue suit, which I guess we really didn't plan that, did we?
No, but we were very on brand.
Yes, very on brand.
Okay, cool.
Well, Michael, there's a lot to take away. Rick was so kind with so many things, and I don't know if there's one particular spot that you want to focus on.
I want to kind of pick up where we left off with my last question, which is just the idea that spine is one of those specialties where spine surgeons are going to get approached by a lot of different people because there's a lot of money in spine surgery. And so there are a lot of regulatory issues that go into whether you participate in a deal. And maybe you can touch a little bit on the flags that people should look out for.
Absolutely. Rick brought up a great point is, for a spine surgeon, orthopedic surgeon, there's so many pieces that you need. You need imaging, you need lab, you need device companies, you need a huge staffing, and there are so many different ways in which these outside vendors will come to you and say, hey, doc, how about doing this deal with us where you're buying this from us? Or how about buying or using our imaging center? And some of those things are very legal. So, but we've talked about in other episodes, Michael, about anti-kickback and safe and stark with safe harbors and then stark exceptions. But you have to be very careful because what we've learned now is even in situations, let's just pretend Rick had something that we could meet the applicable federal and state laws. There are a lot of times in which the hospital says, well, to be on our medical staff, you cannot have any ownership, whether or not it's legal or illegal. We don't care. We have our own vendors. You have to use our vendors, and you can't have any relationship with them.
Avoiding the whole conflict of interest thing he was talking about.
Exactly. And so it's a contract restriction. So even if we can find a way to legally own it from a federal and state perspective, you still may have a contract that makes it that prohibits it on top of that.
Fascinating. Well, I think we need to wrap up here, and I'm gonna type an email very fast to you, challenging you to a pickleball match.
Excellent. Well, I'll be out there with my other retired friends, and we'll crush you. All right, audience members, we're still going with the Specialty Spotlights. Next Wednesday, we have Behavioral Health Spotlight with Brandy Sinclair. Thanks again for joining us today. And remember, if you like this episode, please subscribe, make sure to give us a 5-star rating, and share with your friends.
You can also sign up for the ByrdAdatto newsletter by going to our website at ByrdAdatto.com.
ByrdAdatto is providing this podcast as a public service. This podcast is for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Reference to any specific product or entity does not constitute an endorsement or recommendation by ByrdAdatto. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Please consult with an attorney on your legal issues.